She is open up to me when I said it, she talked to me that she don't.
Okay, good morning and welcome to the Cook County Health Board meeting of Friday, February 27th at 9 a.m. I'd like to call the meeting to order and ask the secretary to call the roll of attendance, please.
Director Bott?
Present.
Director Harrington is absent. Director Kim is absent. Vice Chair Lowry?
Present.
Director Masuda Barnett? Director Ryder is absent. Director Robinson?
Present.
Director Sorrell? Present. Director Staines? Here. Director Webster Cross? is absent, and Chair Garza.
Present.
You have a quorum.
Thank you, Madam Secretary. The next regular meeting of this board is Friday, March 27th at 9 a.m. We do not have any directors remotely participating. And we'll go to item 2, at least my favorite. I think it's the best part of the agenda, employee recognition.
Absolutely. Thank you, Chair Garza. Good morning, directors. Good morning. As always, we'll start with recognizing our new leadership hires, starting with Jacqueline Sweedock, Director of Patient Safety, Quality Assurance, Nissan Puranasupar, Nurse Coordinator 2 with CERMEC, Candace Harrison, Clinical Excellence and Performance Improvement Manager, Behavioral Health, Pamela Kerr, Community and Social Service Manager, County Care, Jasmine Royal, Manager of Complex Care Coordination, County Care, and Victoria Zapata Charette, Manager of Value-Based Products with County Care. Welcome to all. And congratulations to Marisol Nunez, Assistant Director of Operations, Regional Outpatient Center, on her recent promotion. Shift to recognitions. And if you're here in the room with us, please stand so we can recognize you. For severe weather preparedness, we want to extend our sincere appreciation to the buildings and grounds, environmental service, health information, clinical engineering, safety, and infection control teams for the rapid and coordinated and around-the-clock response to 2 recent floods that had happened, as well as cold weather preparation a few weeks ago. Your professionalism, your technical expertise, and commitment to safety were instrumental in mitigating the damage, restoring operations, and ensuring a safe environment for our patients, our staff, and our visitors. Thank you all for the incredible work that you've done. There's a huge list there. I'm not going to read off all the names, but if you're here with us today, please stand so we can say thank you. Right. Thank you again. And congratulations to Dr. Elizabeth Marcus for being named in Chicago Magazine's Top Docs list. She was named as one of the best under the surgical oncology breast cancer category, and this year's list focused on cancer fighters, included 543 area physicians nominated by their peers as the best across various specialties. Congratulations, Dr. Marcus. Also want to share that this month we launched the Austin Health Center Advisory Council, and with this launch, now all of our ACHM sites have a community advisory council. The Austin Council is comprised of representatives from a dozen local community organization partners, and at the meeting, attendees received an overview on Cook County Health, the Austin Health Center, County Care, and the Cook County Department of Public Health. Thanks to the CCH Community Outreach Team, which includes Nick Shields, Marcelino Garcia, Alice Collins, and Kaylin Long for their great work. Thank you all. And lastly, earlier this week, we had a Facebook Live discussion on the 25th to celebrate Black History Month and recognize the role access to healthy, culturally meaningful food plays in preventing illness and sustaining well-being. The discussion included Commissioner Michael Scott, Barbara Deere, advocate and wife of the late Commissioner Dennis Deere, Shannon Andrews, Chief Equity and Inclusion Officer with Cook County Health, and Dr. Arnold Turner, Chief Hospital Executive with Providence. The panelists discussed both the history and the ongoing work to advance health equity through nutrition. Thank you all. I think that concludes the first part of the report. Back to you, Chair Garza.
Okay, thank you, Dr. McInnes. Madam Secretary, are there any speakers registered to provide virtual or in-person testimony, or has anyone sent written testimony to be included into the record?
We did not receive written testimony, but we do have one registered speaker, Lloyd Marshall.
Okay, welcome, Mr. Marshall.
And as a reminder, you have 3 minutes. I'll remind you when 1 minute is remaining, and then when your time has elapsed.
Good morning. My name is Lloyd
Morning.
Marshall. I'm a staff representative with ASME Council 31 servicing Local 1111. I'm standing before you speaking in opposition of the board approving any extensions of the Chicago Lighthouse contract to perform the bargaining unit work of our members. For some time now, Cook County has continued to increase its reliance on subcontracting with vendors instead of seeking alternatives that would bring more work in-house. On January 16th, the union received notice about a contract extension. However, that notice should have been received 5 months prior. It's important to note that there were at least 3 prior extensions or amendments to this same contract that the union never received any notice. The union expressed concerns about the lack of notice and no prior discussions about alternatives to subcontracting. We also requested cost comparisons of the expenses for using bargaining unit employees versus third-party vendors, and to date, we have not received that information. It is the union's position that these acts directly violate the CBA, specifically Section 14.9, and upon further investigation, it was discovered that there was an additional contract also with Chicago Lighthouse to perform bargaining unit work that we were not aware of or notified of. I also want to add that the union recently won an arbitration regarding issues surrounding subcontracting. For far too long, Cook County Stroger Hospital has taken the easy route and just issued contracts and hired vendors to perform union work instead of taking the necessary steps to correct the problem with staffing. We are asking that this board, along with management, respect our contract and reduce the subcontracting footprint within CCH. Thank you for your time.
Thank you, Mr. We will move to item 4, board and committee reports. I'd like to present the minutes of the January 30th, 2026 meeting and ask if there are any corrections that are needed. Okay, I'm asking for a motion to approve item 4A, the board meeting minutes of January 30th, 2026. Can I have a motion, please?
So moved.
Thank you, Vice Chair. Can I have a second? Second. Thank you. Is there any discussion? Okay, all those in favor, signal by saying aye. Aye. All those opposed? Okay, the motion carries. We'll move to item 4B, which are the minutes of the February 6th, 2026 Audit and Compliance Committee meeting. I'll turn that over to my colleague, Director Harrington, to review.
Thank you.
You're welcome.
The Audit and Compliance Committee met on Friday, February 6th at 11 a.m. The next regular meeting of the committee is scheduled to be held on Friday, April 17th at 9 a.m. Nicole Emerald, Chief Corporate Compliance and Privacy Officer, reviewed the report, which is included information in the following subjects and proposed items: the FY25 Annual Report, County Care Compliance Program, FY25 Annual Report, Cook County Health Provider Compliance Program. Information received with following metrics: year-over-year comparison, contacts by category, system compliance program, county care, Medicaid, health plan compliance program recoveries, receive and file annual reports of the Cook County Health, county care, and facing forward, the FY 2026 compliance work plan. The request regarding FY 25 contracts by category for the Cook County Health System Compliance Program was a request made for future reports to include a breakout of the privacy security category that includes the nature of these cases. There was also a request regarding FY 25 contracts by category for the Cook County Care Compliance Program. A request made for future reports to include a breakdown of fraud, waste, and abuse category, and include the amounts. The committee did go into closed meeting to receive a report, but there is no plan to review that today in a closed meeting. So the minutes can be approved at this time.
Thank you, Director Harrington. Can I have a motion to approve the minutes of the February 6th, 2026 Audit and Compliance Committee meeting?
So moved.
Thank you, Vice Chair. Thank you for the second. Is there any discussion? All those in favor, say aye.
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 Aye. All those opposed? Okay, that motion carries. It's been approved. We'll move to item 4C, minutes of the February 6th, 2026 Managed Care Committee meeting. I'll turn that over to Vice Chair Lowry.
Thank you, Chair. The Managed Care Committee met on Friday, February 6th at noon. The next regular meeting of the committee is scheduled to be held on Friday, April 17th at 10 a.m. During the meeting on February 6th, the committee received a report from Aaron Galiner, Chief Administrative Officer of Health Plan Services, along with other team members. That report included information on the following subjects: health plan metrics, quality, safety, and experience successes, growth and transformation successes, policy updates, 2026 strategic initiatives and priorities, including quality, safety, and experience, workforce, fiscal resilience, growth, and transformation. During the committee meeting, a question was raised regarding whether data will be shared at some point in the future on the percentage of members complying with the new mandatory work requirements, which will go into effect on January 1st, 2027. The committee was informed that the data should be available starting in February 2027. Staff was then asked to prepare a brief bullet/talking points to document outlining the changes related to the mandatory work requirements and shortened redetermination period, so we can share that with fellow county commissioners and continue to communicate those changes to the public. The committee also requested that future reports provided on county care workforce include demographics. There are no questions or further discussion needed on this information. I now submit the minutes for approval at this time.
Thank you, Vice Chair Lowry. Can I have a motion to approve item 4C, the February 6, 2026 Managed Care Committee meeting minutes? Thank you.
Second.
Thank you. Is there any discussion, any questions? Okay, hearing none. All those in favor, say aye.
Aye.
All those opposed? Okay, that motion carries. We'll now move to item 4D, minutes of the February 2026 Human Resources Committee meeting, and I'll turn that over to Director Sorrell, who will review.
Thank you, Chair. Human Resources Committee met on Friday, February 20th at 10:30 a.m. The committee's next regular scheduled meeting is scheduled to be held on Thursday, May 7th at 11:30 a.m. The committee received the report from our Chief Human Resources Officer, which is included within the minutes and including information on the following subjects. The overall demographics across all CCH employees, information about CCH human resources and updates, as well as the fiscal year 2026 metrics and hiring impact. This overview included the fiscal year 25 key hiring metrics, fiscal year 25 CCH HR activity report, the current state of hiring and separation from CCH, fiscal year 25 CCH turnover, fiscal year 26 RN hiring metrics showing much improved numbers in hiring of nursing staff, and the RN current state of agency use. We reviewed talent management as well as strategic HR transformation, showing an overall improvement in the direction of our HR and ongoing increases in hiring of nursing staff and overall hospital staff. If there are no questions, the minutes are now being presented for consideration at this time.
Thank you, Director Sorrell. I'd like to ask for a motion to approve item 4D, the February 2026 Human Resources Committee meeting minutes. Can I have a motion, please?
So moved. Second.
Thank you. Is there any discussion? Okay, all those in favor, say aye.
Aye.
All those opposed? All right, that motion carries. I'd like to move to item 4E, minutes of the February 2025 Quality and Patient Safety Committee meeting. Director and Dr. Bob will review.
Thank you, Mr. Chair. Quality and Patient Safety Committee met on Friday, February 20th at 9 a.m. Committee approved the following action items that are included in the minutes. Approve 1 Stroger Hospital Department Chair reappointment. Approve Stroger and Provident Hospital medical staff appointments, reappointments changes. Committee received the following reports, which are included in the minutes. Operations Excellence Dashboard Goals and Tactics, Regulatory Report. Next meeting of the committee will be held on Friday, March 20th at 9 a.m. Committee received a report and closed meeting, but that is not expected to be reviewed today, so if there are no other questions on the minutes, they are being presented to the board's consideration.
Thank you, Director Bott. I'd like to ask for a motion to approve item 4E, the minutes of the meeting of the Quality and Patient Safety Committee of February 20th, 2026, which include approval of the following items. 1, Stroger Department Chair reappointment, and the Stroger Hospital and Provident Hospital medical staff appointments, reappointments, and changes. Can I have a motion, please?
So moved.
Second.
Thank you for the first and second. Are there any questions for Director Bott or discussion? Okay, all those in favor, say aye.
Aye.
Aye. All those opposed? Okay, that motion carries. Moving right along. We will move to the minutes of the February 20th, 2026 Finance Committee meeting. Director Ryder is on his way, so in his place, Director Harrington will review.
Thank you.
You're welcome.
The committee considered the following. The Finance Committee met on Friday, February 20th at 11:30 a.m. We considered the following action items, which are included in the minutes. Conditionally approved 31 contracts and procurement items. Numbers 1, 8, 14, and 21 are pending review by contract compliance. On the screen, you'll see contractual requests from the Finance Committee meeting whose fiscal impacts are greater than $1 million, which are highlighted for your information. We also received and filed grant award-related items. The committee received the following reports, which are also included in the minutes. Fourth quarter FY 2025 report of contracts executed under the authority of the CEO, report of December financials, monthly report on agency reduction plan. The next regular meeting of the Finance Committee is scheduled to be held on March 5th at 10 a.m. If there are no other questions, the minutes are being presented for the board's approval at this time.
Thank you, Director Harrington. I'd like to ask for a motion to approve item 4F, the February 2026 Finance Committee meeting minutes, which contain the following action items. Conditional approval of the contracts and procurement items pending review by contract compliance, and receiving and filing of the grant award related items. Can I have a motion, please?
So moved.
Thank you. A second?
Second.
Thank you. Is there any discussion? Okay, all those in favor, signal by saying aye.
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 All those opposed? Okay, that motion carries. We'll move down to item 5, action items. Contracts and procurement items, none are being presented. So we'll move to the next item, which is 6, the report from the chair. So I just have one item, and that's to inform the board that Dr. Maya Green has resigned from the board due to scheduling conflicts and her inability to participate fully in the way that she would want to. So we want to thank her for her service, and we will recognize her in the traditional way that we do when board members step off the board with the picture of Stroger, I think, right? So it's Cook County Hospital. So once again, our thanks to Dr. Maya Green for supporting the Cook County Health Mission. I will move to item 7 and toss it back over to my colleague here, report from the CEO, Dr. Eric Makaitis.
Thank you, Chair Garza. Once again, good morning. We have 2 items today, an ARPA update with Andrea Gibson, and then a deep dive on Stroger with Donica, Austin, Kathy. All right, so Andrea, you coming up? Okay, perfect.
Good morning.
Good morning.
Morning.
Andrea Gibson, Chief Strategy Officer. This item is an update on the ARPA programming. We have now to date spent $115 million out of the 181. We've made some progress in our processing of invoices to get closer to a 30-day cycle, a payment cycle. The personnel costs, if you recall, are completely in the health fund this year, and last year the personnel costs were paid for by the county corporate fund. We've been accelerating expenditures, working with the subrecipients. We also, with the Office of Behavioral Health, have been working, they had an extension to work through their acceleration plans. So at the end of March, we're going to reevaluate in case we need to take some funding from those subrecipients and, or, reshuffle it, from good spenders to slower spenders, to make sure we pay for that we spend it all. And so now we're just focused on maintaining the pace of our spending. And, as a reminder, this goes through the end of the calendar year 2026. So we need to be on pace, to spend, 6 to 7 million a month. So, any questions?
Any questions?
Thank you.
Nope, thank you, Andrea. Okay, now we'll go to the Stroger Hospital Divisional Report reviewed by Tanika Austin Kemp, Chief Hospital Executive at Stroger Hospital.
Good morning, and thank you, Donna Austin Kathy, Chief Hospital Executive for Stroger. Thank you for the opportunity.
Dr. Lawrence Smith, Chief Medical Officer for CCH.
Thank you for the opportunity to share updates from Stroger. So first off, looking at our quality, safety, and experience, we're starting off where our goal is to ensure patients have access to the highest quality service. Outside of the metrics that we monitor in our quality committee, our priorities center around our HCAP metrics, where we function as key indicators on quality service and really looking at the care. Looking at our priorities, improving inpatient HCAP likelihood to recommend the hospital, which really measures our patient loyalty and experience from 75.49 top box to 77.57. We're currently sitting at 75.62 through January of 2026. Also improving our CMS star rating by increasing our scoring from 41.77 to 52.58. Also improving our emergency department patient experience likelihood to recommend. The key drivers there are really looking at our measurement of our door to discharge, and also the provider communication. There's been some tremendous strides there, and I'll talk a little bit more about that as we talk about the transformation and growth, and looking at really the efficiency of care. We've seen our number of patient experience in the ED currently sitting at 57.78. Looking to also improve our surgical, outpatient, and ambulatory numbers, recommending the facility from a surgical perspective from 78.56 top box to 80.72. A lot of work is being done there, and they're currently sitting at 84.72. So they've already exceeded the range in which we've set forth. We're really focusing on improving the number of surveys that we get. We haven't quite hit our target there in terms of the number of surveys, but we're really focused on really cutting down the wait time for our patients and patients' families, and really, continuing always to improve the overall patient and family experience when people come for surgery. Also, lastly, increasing our patient safety events reports by 10% year over year. We want to continue to encourage the staff to always identify any areas where we can possibly prevent harm and or any vulnerabilities in our organization. So when we look at our continuing our updates, nursing has been making tremendous strides in focusing on communication, really anticipating the needs and making meaningful connections with patients' families. In March, we're going to be doing a leadership boot camp where they're focused on rounds and really keeping our focus on what is the purpose of the rounds, how do you connect with families, how do you connect with patients, and really improving their skill sets there. Also, nursing has also partnered with safety to have 6 of our frontline nurses connect and partner with the safety coaches to increase the engagement, as well as do some peer training with other nurses in that category. And then lastly, from a regulatory perspective, we're always on a continuous survey readiness cycle. We partner with our environment and care. We partner with our regulatory team to make sure that we're always ready for anyone who walks in our house. And it's not about just being ready so we can check the box, but it's making sure that we have a safe environment, not only for our patients, but also our staff. Next slide, please. Looking at our workforce, again, our goal is to be the employer of choice and really continue to invest in our workforce, not only at Stroger, but at Cook County Health. We're happy to have a great partnership with our human resources executives. We ended the fiscal year 25 with a 10% vacancy and our staff turnover rate at 7.94 at Stroger. Our priorities continue to be reducing our vacancies, reducing our reliance on agency, and we talk about that at our finance committee, reducing our recruitment timelines, and really addressing any onboarding delays. And then the exciting piece is always looking at and trying to continue to work on our employee engagement, what it means to engage with our staff, looking at our engagement scores. Our mean score for Stroger at our last survey in 2024 was 3.80, and we really have been focused with our leaders on looking at, areas where there's opportunity in each of the departments. We've asked each of the department heads to put forth action plans where they sit down, listen to their staff, they share the data in their departments, and they really devise a plan to continue to engage. Because, again, we want to make sure that, employees are proud of where they work, they take pride in our organization. We want to know and want to make sure that they intend to stay and that they recommend Cook County Health to others. When we look at a few of the workforce recruitment efforts, we've had a lot of success from January of 2026 through really last week. We've had 113 total starts at Stroger, so 88 external and 25 internal hires. Nursing has had a few hiring fairs. We've hired 29 experienced med-surg nurses and 8 emergency department RNs. So again, a lot of really great work in getting experienced nurses to choose Cook County Health. Over the past few months, again, we have been focused on the agency spend and especially in our nurses. And then we're always incredibly excited about our resident workforce. Actually, today is Thank a Resident Day. And so we're excited that with the National Match Day is actually going to be March 20th. And we have over 7 programs that will match. So anesthesia, emergency medicine, family medicine, internal medicine, peds, preventive medicine, and radiology. The rest of the fellowships and the early match residencies have already been filled. So if you have an opportunity today, we'd love for you to join us to thank our residents today. Yes.
I have a question.
Yes.
Yeah, I'm trying to understand our 10% vacancy rate and the staff turnover rate of 7.94 with respect to similar institutions. Are we doing better? Are we doing worse? I assume we're doing as well as possibly better than that.
Yeah, I mean, I think at Stroger we're doing fairly well. I believe that the staff turnover goal is usually about 4 to 8%. So, we're right in that, but again, we always want to, get those numbers down and really get those positions filled.
National all-in averages run in the mid-high teens. The number I've seen most recently is 18% turnover.
Yeah, I wanted to lift that up because I think we're doing better than most.
Absolutely.
We are doing better than most.
Yes.
I have a question as well. What's the point schedule on the overall employee engagement score? What's the range? 5 points?
5 is the highest using the tool that they have. And so we scored at 3.80.
Yep.
I do want to point out that in 2022, we were lower, and so we increased by 0.19 for Stroger, and really had a great impact in a lot of areas.
Well, I think there's a correlation between that and what I believe was a low staff turnover rate. That's a fair assumption to make.
Absolutely. Thank you for that question. Next slide, please. Looking at our transformation and growth, really our goal is to, again, transform the delivery of care, ensuring that, we provide accessible, standardized, and reliable service for our patients. Our priorities include optimization in our surgical services, looking at our turnaround time and really achieving our volume targets. Leveraging the technologies and new equipment to support efficiency, decreasing the patient wait times, and focusing on our throughput optimization. So when we look at our surgery optimization, they have been doing a lot of work around reviewing the block utilization in surgery. Our first case on-time starts, there's been a collaboration with our environmental services. They've been instrumental in identifying what times it takes to turn over a room. And so we're making sure that because that obviously helps with the flow and efficiency. When we think about the leveraging the technology, one of the areas that we're proud of in November in the nursing, they started the telesitter program, where they have monitored over 80 patients since it started in November in our med-surg division. So both on the 7th and 8th floor, and we've, with more than 9,500 total observation hours. Another piece of technology that's being actually launched, really over the weekend, is the work in our core lab, which includes really a major upgrade to our laboratory automation system. And actually, our system has been, is aging, and actually in desperately in need of a major upgrade. So this replaces not only the aging equipment, but the complete infrastructure upgrades, really to position ourselves for any increases and further increases in our volume. Also, lastly, related to the wait times in the throughput optimization, there really has been a lot of focus in the emergency department on the ED door-to-discharge metric. And there are several key initiatives that have taken place that's really helped us to drive those initiatives. A few of them have been the early diagnostic and lab work expansion that's happened in the triage area. We have now a waiting room nurse role, and that person can help to facilitate initiating not only the labs, the diagnostic testing directly in the triage, so don't have to wait. They're starting it in triage. Also looking at the low acuity patient optimization, and focus on those ESIs, so the low acuities, 4s and 5s, and trying to move them quickly out. Also, and I'll have my colleague speak to some of that because she's much closer to that. Also, the reinforcement of the pool-to-full model in the emergency department and ensuring patients are moved promptly from the waiting room into the open treatment areas. And then not only that, but then the partnership with all of the ancillary and support areas, EVS, transport, lab, and radiology. Dr. Smith, would you like to weigh in on that?
Sure. Just as you all know, the emergency department is a very busy place with lots of things going on. And so our team is really focused on initiating care as soon as possible. And so there's a PA that we have in the front of the emergency department, so they're getting eyes laid on them early to identify sick patients, but also can initiate and start workup, so lab work, et cetera. The team has also looked at expanding use of our yellow team, which is one of the sections, and we can put lower acuity patients there just for more rapid turnover. So there's a lot of work, but again, the ER is a very challenging place, as you can imagine, and they're very nimble at working with patient flows and hopefully we'll continue to see success in that area.
Thank you. Next slide, please.
Can I ask a quick question on that?
So are we actually meeting the volume targets in the surgical area? I know you said that's one of the priorities. Just how close are we to that?
Yes, absolutely. And actually, in the next slide for fiscal, resilience, I have the surgical volume, was at 7.4 above the target, for December. And we're slightly below in January, but we're starting to see that number, still continue to increase. So we're starting out the beginning of the fiscal year already at a 7.4% above budget.
And what is the telesitter program? What does it actually monitor? What is it doing?
The telesitter, so it is virtual, so we have a sitter watching the screen, and it's a lot for our high-risk fall patients and other patients that we may have a concern about that we want a more higher level of observation. And so we're able to have one sitter monitor multiple as opposed to the one-to-one, which is required for like a suicidal patient. So for patients that need increased observational needs, this telesitter is able, and so using that, we've been able to free up our additional staff to help the nursing at the bedside.
Thank you.
A question about, to leverage technologies and new equipment to support efficiency. Could you say more about what technologies you're being referred to?
Yeah, I mean, so not only the teller sitter, but the work in our expansion in radiology. Let's see, what else am I forgetting? Our lab automation. All of that is going to make us a lot more efficient, right? So the aging equipment in the lab, we're able to now put the specimens on this new, when we, have the implementation of the new program, we'll be moving specimens quicker. There's, quicker turnaround time. Also, some of our equipment in radiology is aging. And so there's an incredible team around in the background really working on our capital replacement plan over the next few years.
Thank you. And then I would just consider AI and other tools around solving some of these challenges that you're talking about, both in quality and transformation.
Yes, I will add, not Stroger specific, but we are piloting the ambient listening, so in some of our clinic spaces. And, we're piloting that with some of the providers now, and looking to see how we can utilize that to help decrease physician time, at home completing notes.
While somebody's in the room, I assume that's what you're talking about?
Correct. So when a physician's in with a patient or a PA, you can turn on the ambient listening, and it will kind of transcribe the conversation, and then the physician can go in and kind of clean it up.
And we could use that information to improve service and the quality of service. That's what I'm getting at.
We can, but also just efficiency,
just to do the
provider satisfaction, and patient satisfaction.
But it's also HIPAA. I'm just, for the public,
Correct.
it's also HIPAA protected.
Correct.
That's confidential information we won't release to anyone.
I'd like to recognize Director Ryder's presence and welcome him.
Thank you.
You're welcome. Good to see you. And
Apologize for being late.
no, it's fine. And then I want to recognize Angela O'Banion, who has her hand raised for a comment or question.
Morning. I think they covered it when Donna began to talk about the agent, well as the telesitter program, which is the first phase of patient observer, newer technology, more sophisticated camera technology, which they are classifying as AI at this moment. But there are a number of AI tools that are being leveraged, if you recall, March, April 2025 strategy, IT meeting in this domain. So the team is correct. There are plenty of piloted programs that are. Thank you.
I think we got that. All right. It was a little breaking up there a little bit, but I think we got the gist of it. Please continue.
Okay. Thank you. And just to close out on the fiscal resilience, really our goal here is really to continue to optimize our revenue capture and improve upon our, coordination with operations and finance and revenue cycle. So some of the priorities, again, continuing to focus on our budget expectations for the year and advancing our revenue cycle documentation initiatives. We ended, Stroger ended December 2025 with a $5.5 million favorable variance. We did have a favorable expense variance, so again, we've been holding really well with managing our expenses. Again, touching on our surgical volume, we continue to monitor that and supporting the work in our surgical services. Continuing to look at our patient days, deliveries. We're seeing all of those slightly increase. Our average daily census has gone up in February. Our emergency department has been busy. And so we are seeing our volume begin to increase. Also, there's been a tremendous amount of work in collaboration with finance and revenue cycle, specifically in our interventional radiology, as they look at new CPT codes for their areas, partnering with revenue cycle to make sure we have everything accounted for properly. That always continues to enhance our revenue cycle. And then also continuing to leverage revenue cycle tools that help integrate the data and focus on our billing. The revenue cycle team are working on a tool, the Cerner patient accounting tool, which improves the average daily revenue. Once it goes live, it'll look at the end-to-end revenue cycle, capture charges faster, and really the goal is to have claims be pushed out faster and accurately. So let me pause there to see if there's any questions.
Are there certain surgical procedures or types of surgeries that drive that above budgeted increase?
Well, we get a breakdown, so we know by each of the areas for our surgical volume. And so in our optimization meetings, we look at by services, which areas are beginning to increase. We get an update from the team on where we may have gaps, where physicians may have been on vacation, so we can get a sense, or will be on vacation, so we can get a sense of what the volume is going to look like for that month and what we project going forward.
So we don't know specifically what surgeries are driving the increase.
Off the top of my head, no. We can get the data to know what drove,
that's fine.
which line drove January more so.
Okay, thank you. Just curious. Any other questions or comments? Okay, thank you for the comprehensive report. A lot of great things going on at Stroger.
Okay. Thank you.
Thank you.
Okay, we will now move to item 8. The board will not be going into closed session today. So if there are no other questions or matters to discuss, we can move to adjournment of the meeting. Are there any matters or items to discuss? Not that I want to drag this out, but I certainly want to give the opportunity. Okay, as the agenda is exhausted, I will declare the meeting adjourned. Thank you and have a wonderful weekend. Thank you.